Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESTA accredited exercise physiologist. In this video today, we're actually going to be talking about a topic I'm really passionate about, which is improving posture after breast cancer treatment. So it is amazingly common how often people who've had breast cancer treatment have been impacted where their posture has become chronically stiff. So in this video, we're going to educate you on how you can improve your posture and why it actually happens that posture becomes affected during breast cancer treatment. So if you enjoyed this content and you would like to see more, then please give this video a big thumbs up. Leave a comment in the section below because I would love to hear from you and find out what topics around breast cancer you'd like more information about. And also feel free to subscribe to the channel. It is completely free to subscribe, and if you subscribe and you want to unsubscribe, it's literally the click of a button. So there is no payments with subscription. I used to think that on YouTube channels, if you hit that subscribe button, there'd be some magical, please insert credit card payment. So if you want to subscribe, it is completely free and you can unsubscribe at any time. So without further ado, let's get into this video, improving posture after breast cancer treatment. So first of all, how does posture actually get affected from breast cancer treatment? So after surgery, that's usually when it starts, meaning you can have a really sore shoulder, you could have a sore chest wall, you could have a sore breast if you've had a lumpectomy, you could have a sore drain site, you could have a sore neck potentially. So whenever anyone has any area of reasonable pain in their body, they tend to protect that region. So when you protect your shoulder and your chest wall, you tend to adopt the posture by which you are forward flexed. So we'll tend to close down the area in an effort to make sure it doesn't move too much, because usually movement causes pain. We might even restrict our breathing pattern to stop expansion of the rib cage, and we'll cave forward essentially to in an effort to make sure we're not hurting ourselves more than we need to. So when you overprotect an area for enough time, you then start to go through a period of what we call deconditioning. So technically deconditioning is just wasting of muscle, but there's a twofold issue here. You can waste muscles that help you keep a good posture, but you can also stiffen up your rib cage, and this is the topic I really want to get into in this video today. In a separate video, we'll cover, how to improve posture when we look at it from the angle of improving muscle flexibility through the front of the body. But today, I really want to get into the hard tissue problems that surround posture with breast cancer. So as I said before, chronic deconditioning leads to muscle weakness, which ultimately means that the muscles along the back of your body, which are the ones that hold us in an upright posture for the majority of the day, find it actually more difficult to perform that movement or hold or sustain that posture. So the other thing that also happens, of course, is that our body image gets heavily affected. So what I mean by this is that if a woman goes through breast cancer and she has a mastectomy, particularly whether it's a double mastectomy or a single mastectomy, so if you've had one breast removed or if you've had both breasts removed, you used to having had a breast shape on your chest, and then most of the time a flatter tummy. Often when you have a mastectomy, there's a disproportionate body image problem that happens. And then also there's a bigger problem by which a lot of breast cancer treatment will lead to weight gain, whether it's fluid retention from steroids in chemotherapy, or if you're on hormone blockers that are known to increase body weight, or if you're just emotionally eating to get through breast cancer. There's lots of reasons why people gain weight through breast cancer, but ultimately it can lead to increased tummy size. So if all of a sudden you've gone from having two breasts and a flatter tummy to no breasts and a bigger tummy, then that shape inversion can be quite affecting to your mental health. And so I think that's another reason why women tend to cave, you know, they basically hide their new posture in the same, or sorry, they hide their new shape in the same way that a tall person, particularly if you're the tallest kid in the class, you'll tend to slump down to hide the fact that you're really, really tall. So during breast cancer, you know, posture changes can be coming from multiple reasons, but you know, the three I've outlined there are namely pain after surgery, and then longer term deconditioning that causes muscle wastage, and then on top of that, the body image change. So but what we really want to get into, as I said, is this rib cage stiffness. So let's talk now about how we actually treat postural changes. So let's just talk about how the rib cage gets stiff. So if you do protect your chest wall and your shoulder after breast cancer surgery, you'll tend to go into this slightly flexed position. I might be exaggerating this a little bit, but ultimately it doesn't actually take too much movement in this direction, particularly if it becomes a chronic posture that you adopt, to cause, you know, some issues. So if we look at it from the side, I'll just turn side on so you can see as well what I'm talking about. So what we're trying to describe here is where essentially, if that's good posture, then following breast cancer surgery, some people tend to just slump that little bit forward. You might find they protrude their chin forward so that they can still look up and see their environment. And this ultimately leads to a very stiff rib cage. So it also leads to shortening of the muscles at the front of the body. So if you've caved forward, you're also going to find that the pectoralis muscles, so pec major and pec minor, are going to become short. So then every time you go to use your shoulder, that also is another side effect of poor posture, is your pec muscles are short, and then it's harder to move the arm around, and you can get, you know, tension through your chest. You might even find breathing is restricted, or you might be slightly shorter of breath than you're used to. So all of these postural changes have, you know, bigger consequences. But the big one we want to talk about today, like I said, is the rib cage stiffness that occurs when you fall into that mildly slumped posture. The other thing to quickly mention, of course, guys, is that if you are slumped forward, as you can imagine, if you've got short pectoralis muscles on both sides or on one side, and you've got a stiff rib cage, this is why when people say, oh, you need to pull your shoulders back, it doesn't work, because it doesn't work to correct your posture anyway, because you can pull your shoulders back and you can still be slumped forward. So where we're really talking about improving posture is coming up underneath the diaphragm, extending through the back, so that your rib cage can expand, you can take a deep breath. That's when you can actually pull your shoulders back, is when your rib cage is able to extend. So I just thought I'd point that out. If people say to you, hey, you need to pull your shoulders back, pulling your shoulders back isn't quite getting to the root cause of the problem. I also just want to make a really quick mention of an interesting finding that is really common amongst all of my patients. And I wanted to put this in this video because you guys might go, hey, I've had that myself. Whether someone's had a lumpectomy or a mastectomy, it's incredibly common for patients to present with like anterior lower rib pain. So I'll just half stand up to show you what I'm talking about. So people come in and they've got this rib pain. It could be one side, it could be both sides, but it's amazing how common that is. And my suspicion is that this is part and parcel of rib cage stiffness. The only body part that really travels from the back to the front in the whole of the body is your rib cage. So if there's stiffness at the back, it can then translate to stiffness in the front. So if anyone's experiencing that pain, like either below the breast or below where the breast was, and it feels like a rib, it possibly is stiffness that's actually started from the back of the rib cage. Okay, so what piece of equipment do we actually use to improve rib cage mobility after breast cancer treatment? So this is one of my favorite tools in the office to use. I reckon every single person who's been through breast cancer treatment, or any chest wall surgery for that matter of fact, should ultimately get to a point where they can use this product. So this is ultimately called a foam roller, and it's absolutely fantastic for improving rib cage mobility. It's also going to influence your thoracic spine. So your rib cage attaches to your spine, which is your upper back. That section of your spine is called your thoracic spine. So we're talking about T1 through to T7. And ultimately it's that upper back and rib cage that this product is really going to enhance. So in a minute I'm going to change my camera angle so that I can actually demonstrate how we perform this exercise. These things are pretty cheap to buy, usually between $15 to $25. You can buy them online, you can buy them at major, shopping retailers like Kmart, Target, Big W, certainly in Australia. But yeah, they are very easy to access and they are worth their weight in gold because you only have to do this exercise normally for 30 to 40 seconds a day to get some serious benefit to your posture. So I'll just change my camera angle and we'll show you how to do this exercise. Okay guys, so I've just moved my camera. I'm just going to demonstrate how we do this exercise, but just before I do, I just want to show you that there's actually 3 different versions potentially that you can use to achieve this exercise. Now, just before I showed you the foam roller, now you'll notice this is short, but it's also completely round. So sometimes people will say to me, oh, I've got a foam roller, but it's really long. Doesn't matter what the length of it is, it's more about the diameter, because ultimately the also major important thing is the density of the foam, because when you first start this exercise, if you've got a really stiff rib cage, occasionally it can actually feel like you're being winded when you do this exercise. That's not a reason to stop, but it also might influence how much you can tolerate the exercise. So there are half foam rollers, so you can see the difference between these two. But interestingly, sometimes I find the half rollers are actually more pressure than these, because these can roll as opposed to this is staying in one position on the ground because it's got a flat base. The other option is also rolled up towels. Now, as you can see, the diameter of the towels versus the foam roller, the towels look a lot bigger, but when your body weight sinks onto this, as I demonstrate this exercise, it'll make a little bit more sense, but ultimately as you sink your body weight onto the towels, they will squash down. So when I use towels, I actually use 2 towels rolled up because there's a lot of give in the towels. If you use 1 towel, you'd probably find you just sink straight onto the floor when you do this exercise. So I generally only start someone on the rolled up towels in the circumstance that they find the foam roller is just a little bit too firm on their back. So just keep in mind you can use rolled up towels. There's a full round roller, and then there is the half roller. So let me just demonstrate how we use the full round roller, and then we'll go through that first. I've just moved my camera back a little bit further, guys, so you can see this properly. Ultimately, you don't have to do this exercise on the floor. If you have got a very firm mattress, you could do it, but ideally it's probably something you do want to do on carpet or a mat or a rug. Just make sure that if you're going to do it on the floor that you can get up and down off the floor safely, of course, or you've got someone to help you on and off the floor, because the last thing we want to do is do this exercise and then hurt you by getting up and down off the floor. So we want to put this foam roller basically somewhere in our upper back area, so ideally between our shoulder blades. So I'm just going to place it on the ground, and I just put my fingers on the foam roller as I lay down to keep it in place. And then I'm going to position my hands behind my head because I don't want to be lying here like this and my neck muscles are working really hard to hold my head up. So I do position my hands behind my head. Now, if you do have a sore shoulder and you can't get your arm into that position at this point in time, a little cheap way is to just wrap your hands behind your neck, but just bring your elbows together, because that's a really easy way to do this exercise without overtaxing your shoulder. The beauty of getting your shoulder into this position, though, as you'll see when I lean back, is that the exercise also gives you a massive stretch on your pectoralis muscles, which were the muscles I was talking about before, which end up getting quite tight after breast cancer treatment. So your hands are placed behind your head. Now, the most important part of this exercise is that your bottom stays on the floor. What we want to do when we first do this exercise is just extend our back over the foam roller. So ideally it just looks like this. So your bottom stays on the ground and all you're doing is leaning your body back over the foam roller. Now you might stay here for 30 seconds or as long as you can tolerate, and then you can slowly come up. Now what you can do from here is you can then move that foam roller into certain positions. So as I said before, this one you can roll on. So you can shift a little bit down, you can shift a little bit up, and then you can extend again. And you might do this in 3, 4, 5 positions if you want to, because what you'll find is that at different points along your upper back rib cage, there'll be parts that are stiffer than others. So go exploring and see what you can find when you move the foam roller up and down a little bit. The other way you can do this exercise, or an adjunct to this exercise, is to use the foam roller like a rolling pin. So this is where you can pick your bottom up and you can roll. Now, just got a few clicks and cracks when I did this. So this is an alternative to the exercise. So the only thing I warn people about with rolling on the foam roller is that this is not necessarily improving your posture, because if you lift your bottom up, your back is still flat or it's curved. It's when you do the extension over the foam roller like I demonstrated in the first movement, that's where you get the real benefit from with your posture. So just make sure you're aware of what you're doing depending on whether your hips are staying flat on the ground or whether they're lifting up. So as far as frequency, I would say if someone's trying to work on improving their posture, you could use this exercise once to twice a day. I wouldn't necessarily do it more than twice a day. I don't think there's a huge amount of benefit in doing it more than twice, but certainly between 1 to 2 times a day would be brilliant to improve your posture, with a duration of say 30 to 40 seconds at a time. The only difference usually between individuals is how far back they can extend. So when you first start this exercise, if you put your hands behind your head and you go to extend and you can't go very far because you're so stiff, don't worry, it will improve over time. It's not how far you can extend when you first start, it's how far you can extend after you've been doing this for a couple of weeks or a couple of months even. So that's the end game. I will do a separate video on how to perform pectoralis muscle stretching, because that's a really good topic to talk about in conjunction with this problem of posture, because as you can imagine, improving the mobility of your rib cage is only sort of half of the problem. If you're really tight through your pectoralis muscles and you only open up your rib cage with a foam roller, you might not also be addressing your pec tension. However, like we demonstrated, if you can get your arms into this position and extend over the foam roller, you're getting a fantastic stretch through your pecs. If people want to take it to another level, if you've got the space on the floor, you can extend over the foam roller and stretch your arms out at the same time, and that will give you an even bigger stretch through your pectoralis muscle. The only thing to note with doing that is that then you take your support away from your head and neck, so you have to have quite a strong, stable neck to do that exercise without holding on behind your head. So just keep in mind that the only time I would say to people to not use the foam roller is if they try to use it and it causes neck pain, it causes headaches, because it may mean that your neck is just a bit too stiff to perform this exercise initially. Thank you so much for watching, guys. I really hope you've enjoyed this video. Please reach out and let me know if you have any further questions around posture after breast cancer. I release a new video every week on the topic of breast cancer, so stay tuned for next week's video. I'm Jen McKenzie, the Breast Cancer Physio. See you next time.